So from what I read, the knee is the biggest issue.
The knee is the biggest issue. About back in May, to be honest with you, I trained jiu-jitsu, as you know, and I did something, and I actually was having numbness in my foot.
Okay.
So, and it lasted for a while in my toes. I woke up the one morning, and for about a full day, I would say, I had numbness in my foot.
Okay.
So then there was months that went by where the tingliness would just show up in the morning and it would just, dissipate throughout the day. I, knock on wood, I have not had that, but since then I've just had a lot of issues here.
Okay.
I did get an x-ray done.
Yep.
And they said that I had something floating around in there. That's
Some
literally
sort
what
of
they
something
said.
floating around in there, okay.
Yes, they said I had a slight tear. I don't know what exactly, maybe meniscus or something like that.
All right.
But nothing that was completely, done. So everyone just says, well, stop doing what you're doing. And I said, I can't.
I don't want to stop doing what I'm doing.
It'll be like
posterior knee, like back of the knee?
Yes, that's really where it stems from. I haven't done squats or deadlifts in forever, which sucks.
Well, then we definitely need to figure that out.
Yeah, I know.
Without a doubt. So,
yeah.
Little young to stop using your knee. Yeah.
I know.
We need to keep that going. All right. Well, what I'm going to do, and what we typically do is get this down, get the story down, right? Then we're going to look at your structure.
Okay.
And so I'm going to take a bunch of measurements. There's like 83 measurements that I'm going to take. So we're going to do standing, we're going to do lying down, and we're going to do sitting. Much more developed here than you are here.
Oh, really?
Yeah. The musculature.
That's interesting. This is so cool. I'm like, what?
You do better sitting down. Definitely do better sitting down. Those are all level. No, that all looks pretty good. You should sit more. This is showing that your right hip is higher than your left hip. Your right shoulder's higher, just like your hip, so they both kind of follow each other. But by the time you get to your head, everything levels out. Okay, so you've leveled out very nicely here. Nice symmetrical cranium. Good for being on video and stuff like that. So
this is true.
Good symmetrical cranium. The shoulder blade is also higher, so it's pretty much higher on the right. You're going to see a theme of everything higher on the right. Like you've kind of got that going on here. You also flare that right shoulder blade, which means it's kind of coming off the ribs a little bit more than the left. Your muscle was tight enough on your right side that I couldn't feel this bone. That when you're standing, there was enough tension in that right hip that I couldn't actually get to the top of the hip. That's not normal. I'm usually very good at getting, I've been doing this a long time. I'm usually good at getting there.
That's my left side?
That your right side.
Oh, it's my right side.
Your right side had the most
tension. Gotcha.
I could feel the left a little bit, the right I couldn't get anything at all. When you lie down, starting at the top, you look great. Cranium is symmetrical, shoulders are symmetrical. Even that rotation and the tilt in your shoulders all goes away. Like that, you level out perfectly, so that's wonderful.
Yeah.
When I get down here to the lower body, you'll see that tilt in your hip is still there.
Okay.
It's not as pronounced as it was. It was really pronounced kind of standing. It wasn't as pronounced. But when I get down to like your heel pad, you'll see that is lower on your right. I need to figure out why did it shorten over here on the left, even though it's your right knee again. There's the reason why it's shorter on the left could be important. Your x-ray is going to help us with that. The reason why the legs are kind of jumping out at me is when I look at you sitting, everything levels out.
Fine.
Like everything levels out.
So it's like,
so as soon as I take the legs out of the equation,
we're okay.
You do great. Like you do fantastic.
All right, just chop them off.
So yeah, That's my first suggestion. We're just going to chop
We're
your
gonna
legs,
chop off your legs,
and then you'll be great. What that means is, as soon as we figure this out, you're gonna be great. Like you're gonna be great in a very quick amount of time.
Awesome.
Okay. Because of the hip difference, if we looked at your gait pattern, if we looked at how you walked, we would see that this knee's, every time you're taking a step, it's getting a little bit of a torque. You had this done just a couple days ago.
Yes.
Yep, there you are. Okay. That right side was high.
Yeah.
But the right side was low at the heel.
Yeah.
One of the things that can represent is that one bone is longer than the other bone.
Okay. Okay.
And it looks like that might be the case for you. So what I'm here with a measuring device right there, and I'm going to go right to the top of the other one. Right there. And you can see that this is the difference between the two sides. It's that much. That turns out to be 16 millimeters.
Sorry, I'm just like, that's wild to see it like that.
Right. When we do that same thing at the top of your hip. Right, it becomes a little bit bigger at the top of your hip.
Yeah.
And then see this little wing right here, this thing, and you see this one over here?
Yeah.
That's your sacrum. That's called the greater wing, your sacrum. And if I look, your whole sacrum is tilting like that. All of it's taking place L5S1. The good part is your spine's pretty straight. That's why all your discs are great and you're looking good. The bad part is it's putting a lot of pressure on that one disc, and you're putting a lot of it on the right side. A lot of this, you're compensating and trying to pull this and get this into the right spot. Like, it's all compensation. There's a reason why that right was so much tighter than the left. Looking at your chart and looking at this together, it looks like a lot of it's in your bone.
Yeah.
So sometimes you're growing, your right side grew more than your left side.
Yeah.
And that's probably why you're twisting when you push off on this, and that's why it's not healing, and that's why it's gonna keep hurting you until we figure this out. We're gonna go back in the room. I'm gonna try a couple things to see what levels you out, just kind of eyeballing it.
Yeah.
Absolutely.
It's very Halloween-y. Like skeleton.
Yeah. We themed that for you, yes, absolutely.
Profile picture right here.
So that's 10 millimeters, that's how big 10 millimeters. I'm gonna put this under this foot, so we're gonna, okay, so it's, oh, look at that, I can feel your bone.
Oh yeah, I can feel you feeling the bone, like it's stuck out.
Yeah,
wow.
Like it's right there. Now I can feel it because that immediately took some tension out of that hip.
That's incredible.
And so,
that's wild.
Now, like, all I gotta do is take that back out.
And I can immediately feel that shift.
Yeah.
Immediately.
Yeah. And now, feel all that. There's muscle.
Like, now I'm feeling it.
Yeah.
That's so crazy.
Yeah. It's so that's part of what's going on. So put this back under there.
Such a small but big thing. Yeah. I wonder how this would feel like walking. You know?
Right.
Like.
And it will like.
Yeah. You know what I mean?
It's going to feel very different.
Yeah.
And it's going to be part of what heals up your knee.
That is very significant the minute that pops out.
Yeah. That's what I'm going to send you with is that right there to stand on, so that we can get this x-ray done and know to the millimeter kind of what's going on there.
That's good.
In the meantime, I do want to see what muscle is bothering the back of your knee.
Yeah.
So I'm going to actually have you lie face down here.
Okay.
Feel that kind of flip right there? There are two muscles back here that are kind of small. One's there, and one's there. And they're the popliteus and plantaris. It's all tender. Okay. It feels like it's a little guitar string in there. Those two little tiny muscles are probably where your pain's coming from. Yeah. I'm just going to check hamstrings here because they do cross the knee as well. They're not screaming at me. The other muscle that does cut across your knee is your gastrocnemius, which is this guy. And it has two little heads. One that comes up this way, and another one that comes up this way. How do those, is that?
They're a little tight.
But not.
But nothing that's like tender.
Nothing, not as tender as when I was in.
Yeah, when you're in there.
When in there. Yeah.
When you're
And I mean, you can just feel it kind of bloop. Right, I can loosen this and it'll feel good for probably 3 days.
Yeah.
And then it'll come right back if we haven't fixed the core issue here, right? And that's what people do a lot. Is, they'll get the thumper machines, the massagers, and all that stuff, and they'll they'll get it, but it'll come right back. There's benefit, even when it's a knee problem, of looking at the whole body, right? Is that a lot of these things can be driven from somewhere. And you might be easier than I thought. That actually is not nearly as tight as I was expecting it to be. So that's great. So the solution, right, is probably going to be sliding something in your shoe.
Yeah. Okay.
Right?
Yeah.
Is that's going to be your long-term solution. Okay. I understand jiu-jitsu is done barefoot.
Yes.
And so you can still do that, right? But when you're not doing that, we're going to want you leveled out so this thing has time to heal and heals up the way it's supposed to. Okay. Yeah. And your gait pattern, you're not twisting and pushing off and doing all of that, right? So what we got to figure out is how much we're putting in your shoe and what's going in there, and that's going to come from that second X-ray that we get, and we'll figure that out, and then we'll kind of start that. Once we start it, your body's going to take about 2 weeks to go through a little transition that it needs to go through, and then you're going to feel really good.
Not simple, but simple. Like, you know what I mean? Like,
yeah, I think we've found your source.
Yeah.
Yeah.
Oh my gosh, I feel so good.
Yeah, we found your source.
I've been to so many people, they're like, you're done, like, you got to do this. And I'm like, oh my gosh.
No, it was pretty easy to see. And the X-ray confirmed it pretty well. Yes. Exactly what we saw on our chart.
I was told I needed surgery in different areas, and I'm like, why? Like, you know, and like,
you're way too healthy. Like, your body it's going to heal up like this.
Yes, that's what I thought. Yeah.
And so you just gotta get in the right spot. You've just been fighting this thing that you don't need to fight.
Yes. Oh my gosh, I feel like I'm gonna cry. Thank you.
Yes, absolutely. My pleasure.
Oh my gosh.
Yes, great to see you.
Yeah, that's so awesome.
Once you get the X-ray, we'll bring it back. We'll look. We'll figure out what the plan is there.
Okay, love it.
Okay.
Yes.
All right.
Okay.
It was great to see you, Vicki.
Oh my gosh, you too.
And so we will follow up, and in a month, you're a completely different lady.
I need to document this.